Hi, welcome to MDRG's webinar for understanding how COVID-19 is impacting the healthcare industry. I am Stephanie McGee. I'm the Director of Marketing and Operations here at MDRG. And I'd like to introduce to you our speaker today, Sandra Brown. She is the President and owner of MDRG. Her background prior to founding MDRG is in healthcare. She was on the client side for quite a few years, and really that's where her passion for healthcare market research started and has been nurtured through her time here at MDRG, where obviously we serve multiple healthcare clients. So with that, I'm going to throw it over to Sandra Brown to take us through some of the research results from MDRG's tracker regarding COVID-19 impacts.
Great, thank you, Stephanie. Good morning, and thank you for your time. I appreciate this opportunity to talk with you about what we are seeing in our COVID-19 tracker. It's a nationwide study that we've been conducting over the past 8 weeks that focuses on consumer sentiment and how that sentiment is changing behavior. I think it goes without saying that the entire landscape of our lives has changed, and not just healthcare. We've seen 73% of consumers say they've started buying groceries on apps, with 53% of those increasing their usage over the duration of the past few months. Most in-store shoppers have tried new brands, probably because their favorite brands weren't available, and yet almost 60% of them say that they will continue to use that new brand. And once we got over our concerns with ordering takeout food, we've seen an increase in takeout and delivery. While restaurant delivery had already taken hold amongst younger consumers, older consumers are figuring this out and finding it convenient and easy. So what about healthcare? Despite the obvious challenges, our data shows that there is a significant opportunity to reclaim our primary role with the healthcare consumer and compete with the healthcare tech companies. We're seeing an increased trust in healthcare providers that we've not seen in the year or so leading up to COVID-19. In healthcare, however, we must embrace the new digital buyer and embrace their expectations. This new consumer is asking us to change and meet their evolved needs. They will be loyal to and reward those who provide what they are asking. I want to go back about 6 months ago when I presented at a SHSMD conference. It's the Society for Healthcare Strategy and Market Development, about consumerism and its impact on healthcare. My premise at that time was that we must innovate or expect to lose relevance. We were seeing new companies, especially tech, spring out of unmet consumer needs that were taking market share and gaining patient trust, where we in healthcare and the provider level and the system level were lacking. At the time, I was talking about the need to reframe the conversation within our organizations to meet patients where they are. That's all changed. And that's not to say that consumer expectations are not still influenced by the Amazon effect, the effect of I want it when, where, and how I demand with respect to healthcare, that their experiences with more digitally savvy industries don't influence their expectations in healthcare. Our data is showing that while the expectations for immediate access and intuitive interfaces are still high, it's who consumers trust to deliver those services that's changed dramatically as a result of COVID. Our expectations outside of healthcare were pre-COVID and still are influencing patient expectations. And while some of our behaviors were temporarily halted by this pandemic, such as using Lyft and Uber and early on our willingness to order takeout, we're seeing some of those behaviors coming back as the panic is subsiding. And those experiences in our everyday lives are still influencing what we expect from healthcare. If you think about it, we can customize our music and video offerings in a highly personalized and curated manner. Now, our ability to grocery shop from our cell phone is in higher demand than ever. And yet, as a result of this pandemic, health systems and health providers have an opportunity to compete that was not there pre-COVID. Pre-COVID, we would have talked about the huge challenge that health systems had in overcoming consumer openness to healthcare solutions from outside of the industry. And it wasn't just convenience and ease of use. Digital natives trusted innovative tech companies to develop the best tools to find and select healthcare services. But so did those over the age of 45. Digital natives, those 18 to 44, trusted Amazon, Apple, or Google twice as much as they trusted the local hospital and health system. And for those over age 45, we were at parity. Trust was what was needed to earn back. Trust along with providing access and more intuitive interfaces. So enter March 2020, enter COVID-19. Clearly things have changed. We have one client who has seen an 11-fold increase in telehealth visits when comparing all of 2019 to the first 4 months of 2020. This crisis has just accelerated the pace of what was coming. That doesn't mean that consumers won't go back to in-person visits, but the objections and the learning curve that got in the way of adoption is overcome by necessity. Going back to pre-COVID, this slide that we've already talked about would have pointed to the huge challenge that health systems needed to overcome in consumer openness to healthcare solutions from outside of the industry. Pre-COVID, we would have talked a lot about how these solutions are being offered and how to get ahead of them and figure out what our advantage was in healthcare. It was almost a defensive position. Now we're seeing in our research those same challenges are now an opportunity. The numbers are flipped. In last week's tracker, we asked the same question that I showed you on the prior slide, and we see that 40% of respondents felt they would most trust a local hospital or health system to develop the best online tool to find and select the right healthcare services, with tech industry giants like Amazon, Apple, and Google trailing behind. Jumping ahead to some of the research findings that I'm going to share with you in this webinar, hospitals and health systems are the most trusted as sources of online healthcare tools, information, and telemedicine. Healthcare consumerism will only continue to grow in significance as the long-term effects of this crisis plays out. Challenges the industry has long faced: the rising cost of care, increasing patient volume, changing patient expectations, the demand for transparency, will continue to be exacerbated by the outbreak's rippling impact on social and economic structures of life. Pivoting and adapting to the current crisis and its long-term impact will require that health systems and hospitals are actively engaged with consumers. It will require actively listening to consumers, understanding their expectations for the patient experience. And while times are difficult for providers right now, providers are in the enviable position of holding the patient's trust. I like this quote because I think it sets up what this presentation and what the opportunities are about. To be trusted is a greater compliment than being loved. Trust is an emotion that's built over time, over multiple interactions that go well. It means believing that a brand or a person will do what it says it will do. And while delicate and easy to break, trust is a greater indicator of preference and loyalty than simply affinity. Edelman, a consulting firm, has a trust barometer on brands. And their trust barometer shows that brand trust is on par with quality, value, and convenience as the ingredients for purchase consideration. 71% of people agree that if they perceive that a brand is putting profit over people, they will lose trust in that brand forever. Healthcare has not done this in this crisis. We've treated patients and employees well, and we've treated them first and put them at the forefront. And then we were willing to address volume and revenue challenges later. So how can we continue to prove our trustworthiness as leaders in healthcare and at the same time get back to business as efficiently as safety affords? It starts with listening to our patients. In our tracker, we've watched as consumers have moved from concern that healthcare providers won't have the necessary resources. It was never about concerns around expertise, to admiration as to how their local healthcare providers are coming together and cooperating despite the dangers. In short, they've trusted you to do what they need, to figure out how to meet the demand, to be there for them. MDRG's COVID-19 tracker is in its 8th week, which will be released in a few days. And while expansive in terms of covering multiple industries and understanding sentiment and behavior, in this webinar, we're going to cover changes in healthcare consumers' perceptions, changes in consumers' consumption of healthcare services and information, and recommendations on how to best adapt to changing expectations and needs during and following the COVID-19 period. Last week, in week 7, we saw an uptick in concern for safety. Concern about one's own safety was higher than at any point in our 7 weeks of tracking, and concern is still high for others' safety. That fear is driven by a loss of control, which has been prevalent all along. As consumers, we are used to having some semblance of control over our lives. And as states reopen, there are celebrated reports of crowded beaches, large gatherings, and shoppers in malls. As these states reopen, consumers are scared, they're fearful about the resurgence of cases. People do not want to go back to the strict closures, the loss of control, and the high hospitalization rates. On the other hand, consumers are feeling more confident that healthcare providers have the resources and the expertise to keep up with patient demand. They believe that healthcare providers can overcome the challenges around lack of PPE, beds, by being resourceful and determined. To give you an example of a local system here, Oxnard Health System, Warner Thomas, the CEO, has been working to champion a ventilator sharing system across the nation, working to help businesses within the state of Louisiana get what they need to get back up and running, and most importantly, working with local companies to repurpose their operations to assist in the need for additional protective gear and hand sanitizer. Now, I'm sure there are countless examples of similar stories. It's just the one that comes to mind most immediately. Healthcare workers are the heroes. In week 2 of our tracker, healthcare workers took on the hero archetype in the minds of consumers. Essentially, where there's a will, there's a way. By being courageous, figuring out how to become as competent as possible in beating COVID-19. That's about the time that we started seeing healthcare heroes signs everywhere. Our research underscores why those signs and sentiments are so popular and reassuring. In our tracker, we explore how consumers are feeling about the current circumstances. We at MDRG know from behavioral economics that emotions drive our behavior, and emotions can't be accessed by direct Q&A. While feelings and emotions are oftentimes the driving force, the side of the brain that drives emotions is non-conscious and not language-based. So we rely on indirect tools that use metaphor and imagery to help us unpack emotions. While I don't want to go into details about research methodologies in this presentation, it's important to know that we can't just rely on what consumers say. We need to observe how they behave and respond if we're truly to understand their underlying emotions and feelings that are driving behavior. this pandemic has left people feeling trapped and helpless. We see images being selected, such as a broken egg, and it being described as cracked and frazzled. I feel out of control, not able to help myself, and the things that are happening. Or a visual of a road leading into a dense, dark forest. And having respondents tell us, because you can't see what's ahead of you, it's full of uncertainty and darkness. And these feelings have led to anger and anxiety about protecting oneself and one family. Respondents selecting images like a lion and saying, I feel angry and on guard to protect myself and my family. Another image that rose to the top is someone meditating in nature. And hearing from them, I have a lot of anxiety right now because I don't know what is going to happen. Ultimately, consumers feel they lack control over their health. We know that these emotions that we saw on the prior page and are seeing in our research ladders up to a deeper emotional construct. And in this case, it's the control metaphor. Deep metaphors are fundamental frameworks that human beings use to orient themselves to their experiences. Metaphor theory tells us that there are 7 deep metaphors that account for 70% of the way that we orient ourselves to the world. So the control metaphor centers on our ability to control our environment, our circumstances, and reality. And we all need some degree of control, and that's what's been yanked out from under us as a result of COVID-19. The loss of control is acute. Healthcare brands have an opportunity to help consumers regain feelings of control over their health. Just to give you an example of the control metaphor at play using a very different industry, think about Wheaties. Wheaties could be just a generic wheat cereal, but by understanding the context for framing the product, they've turned it into something far more compelling, a product that allows consumers to have power in controlling their destiny. The breakfast of champions. Champions are in control of their destiny. So how can healthcare brands help consumers regain their feelings of control over their health and help them feel safe? This is something they asked for pre-COVID. Now they need it, they expect it, and they will not go without it. So I'd like to begin to focus more narrowly on healthcare perceptions, what's changing from a perceptions perspective, and more importantly, from a behavior perspective. In a time characterized by the uncertainty of COVID-19 and the increased use of virtual visits out of necessity, who do consumers trust most to provide healthcare services, tools, and information? That was the first question that we began to unpack. Overall, hospitals and health systems are most trusted as sources of online healthcare tools and telemedicine. For instance, on the left-hand side of this chart, you see here that 51% of respondents most trust a local hospital or healthcare system to deliver high-quality telemedicine. And on the right, 40% of respondents feel they would most trust a local hospital or healthcare system to develop the best online tool to find and select the right healthcare services. In both of those instances, in both of those questions, tech giants trail behind significantly, but so do insurance and retail. Healthcare has an opportunity, healthcare providers and health systems have an opportunity to reclaim this trust and this position. So I guess you could look at this as a silver lining of sorts, if you will, from COVID-19. When it comes to telemedicine, boomers take the lead in trusting local hospitals or healthcare systems over other options. Looking at these generational cohorts, we see that 60% of boomers trust local hospitals and health systems most to deliver high-quality telemedicine. That's relative to 50% of Gen Xers, 42% of millennials, and 45% of Gen Z. Millennials, Gen Z, Gen X are still more likely than boomers to trust tech companies like Amazon, Apple, or Google, or even other online telehealth providers. But the real story here is that they trail hospitals and healthcare systems in trust across generational cohorts. What's the takeaway? Consumers' trust in local hospitals has increased since the outbreak, though some younger generations have less loyalty and more openness to alternate healthcare delivery systems like retail and digital tools. While hospitals and health systems have an advantage, there is still a need to prove ourselves to a younger healthcare consumer. So our recommendation and conclusion is that these findings indicate there is perhaps room to educate consumers and normalize the idea of using local hospitals' digital health services, particularly for men. Compared to women, men are significantly less likely to trust a local hospital system to deliver high-quality telemedicine and develop the best online tools for selecting healthcare services. The increase in trust that has characterized this period of time might also serve as an opportunity to improve engagement with groups that were previously less trustful of local health systems and hospitals, younger consumers and men. Figuring out the best way to message telehealth and virtual visits is something that we need to focus on or continue to focus on. The second question that we asked is, what channels of communication do consumers prefer most, trust most, when addressing healthcare issues such as COVID-19? Previous studies show us that consumers have long described themselves as willing to try virtual video visits. However, rates of actual use have only jumped recently out of urgent necessity. For instance, one study found that 13% of respondents had accessed a virtual visit or telehealth over the past month. Amongst those, 83% reported being first-time users. And so we've long known that satisfaction rates were high with virtual visits. The challenge was always adoption. And among the recent adoptees of telehealth since COVID, we are seeing equally high satisfaction rates, indicating that telemedicine might continue, or I would argue will continue, and grow even after the necessity for use due to COVID-19 no longer exists. However, the ease or perceived ease of access to virtual visits varies by generation. Now, the majority of respondents felt they could easily access healthcare services using virtual visits. Certain groups agreed with this statement less than others. For instance, boomers were less confident in their ability to easily access healthcare services using videos than millennials or Gen Xers. The Gen Z number, however, is interesting. We believe that this is because they aren't using much healthcare and thus wouldn't necessarily know where to start. It has nothing to do with their comfort with technology. So there's a different message for them. And in fact, I would suggest that if they knew this was available, they might avail themselves of healthcare more. These findings are correlated with other research that shows baby boomers just tend to be less comfortable with technology and with video visits than younger generations. So our challenge there is to ease that transition where appropriate. Overall, baby boomers have the most resolute expectations as to how they would seek help. So the question we asked was, imagine you suspected you had the coronavirus. Please rate the extent to which you would be likely to seek help from, and we listed 6 different sources and asked for their agreement on a 1 to 5 scale. Boomers had the strongest opinions on which forms of help they would seek. A phone call to a health provider to discuss their concerns about COVID. They are highly unlikely to go to the ER or urgent care, which means that they've heard the message. Younger generations, however, have fewer strong opinions, pointing toward more flexibility in how they seek help. For instance, they're more open to using newer channels of communication like an online chat with a medical professional. Although they are still more comfortable with a phone call, the story across generational cohort in terms of comfort level remains the same. From a takeaway perspective, the use of digital tools is accelerating. However, phone calls are still preferred for reaching healthcare providers, specifically about COVID-19 concerns. It's particularly true for boomers who are more at risk and more likely to be comfortable. So we need to continue to give options for access. Improving accessibility and awareness of telehealth visits for older populations, or allow patients to opt into their preferred communications channel. These findings suggest that there is perhaps room to educate and normalize this idea. This increase in trust that has characterized this period of time might also serve as an opportunity to improve engagement with groups that were previously less trustful of local health systems and hospitals. Our third question we asked is, what channels of communication do consumers prefer most when addressing healthcare issues during COVID-19? Survey results show an increase in the amount of medical information consumers look up online, with 31% of consumers looking up more than they did pre-COVID-19 outbreak. Gen X, Millennials, and Gen Z were particularly apt to have increased their consumption of medical information online. And this is not a COVID-19 phenomenon. The internet, being this infinite storehouse of inconceivable information, healthcare or otherwise. You can watch a dog playing the piano, or you can buy an inflatable blue spaceship from Star Wars. You can find anything or almost anything online, which is great. But at the same time, it means that it's difficult to distinguish useful data from junk information or factually incorrect information. And this phenomenon is even more valid in the case of healthcare information, especially keeping in mind that nowadays almost every patient searches for their symptoms and treatments online. However, most medical professionals have never had training about digital literacy and thus can't help their patients surf through the internet to find the most useful tips and treatments. We already had WebMD, smartpatients.com, drug.com pre-COVID, but with COVID, consumers are living in a time of uncertainty with many unanswered questions, which is driving them to seek out information where they can find it, usually local news or national news sources, government websites. A recent study found that only 14% of consumers rely on health systems and hospitals for information. We believe that this pandemic might serve as an opportunity for health systems and hospitals to increase patient loyalty and trust by offering accurate sources of information, by being that go-to place for information. From a takeaway perspective, consumption of medical information has grown. 31% are saying they're looking up more information than they did prior to the outbreak. What these findings indicate is that there is perhaps room to be the source of trusted information, to become the place where consumers can go to separate fact from fiction. This increase in trust that has characterized this period of time might also serve as an opportunity to improve engagement with groups that were previously less trustful or less engaged with local health systems and hospitals. Men in particular have been less trusting with local healthcare systems. COVID-19 has brought about an opportunity to convert them. Our last big question: when will consumers feel comfortable coming back to in-person care? Now, we've been asked to look at this for our healthcare clients, both for primary and routine care as well as for elective procedures. However, healthcare is not alone here. We're looking at this issue for clients across industries. For example, what will it take to get consumers to come back into the bank branches, to begin transacting financially in the branch? While we believe that consumer behavior will be altered forever as a result of this forced adoption of non-traditional healthcare delivery, the real question is, how will it be altered? And more importantly, how do we adjust to those changes while still maintaining a relationship with our patients? Because the relationship is the key to retention. What we found is that consumers are somewhat divided in terms of how comfortable they are coming back for in-person visits. Though just over half of consumers, 51%, reported feeling comfortable, somewhat or completely comfortable, going to a primary care provider for in-person visits. 31% of consumers report feeling uncomfortable with in-person visits. In total, if you do all the math there, what we can tell you is about 20% of consumers are saying that it will be more than 3 months before they are willing to resume in-person visits, with some saying as long as 9 months or more. And we know this varies somewhat by state. Increasing trust and engagement will be the key to helping consumers feel comfortable with returning to in-person visits. It will be the key to increasing volume. Thinking about elective surgeries, we asked consumers to rank a number of different procedures, surgeries in terms of most comfortable to least comfortable coming back for. And there's some definite opinions from consumers that certain surgeries will be safe soonest. Among those are screening procedures such as colonoscopies and minor dermatological procedures. We hypothesize that this is because they are less invasive, but also rather uncomplicated in the grand scheme of things. Some of the surgeries that consumers think will take longer to perform safely are gynecological and orthopedic, which tend to be more invasive and more complicated. Cosmetic surgery is one that consumers are willing to say will be slow to come back. If you notice the high number of respondents who say that that will be last, it occurs to us that this may be based on the judgment that it's low in terms of necessity and therefore should be put off for now. Now, this is just one data point that health systems and hospitals are going to have to take into account as it begins to think about which elective procedures to start rolling out first. You're certainly going to have to look at volume. You're going to have to look at revenues, but also, and maybe most importantly, you're going to have to look at, are you ready as a facility? Do you have what you need in order to perform these procedures safely? So this, representing consumer sentiment, is one piece of that puzzle, is one part of the answer. Another way to consider our original question entails looking at the circumstances under which people will feel comfortable returning to in-person care. We found that ultimately consumers look to local health systems or hospitals for an indication that it is safe to attend in-person visits. The results found that 63% felt they would need a hospital or health system to report that it's safe in order to visit if they were to feel comfortable making an in-person visit to their primary care provider. The CDC was not too far behind, with 56% of respondents saying they would need reports from the CDC that it was safe to visit a PCP. Followed then by state and local leaders, and then looking at new cases and deaths. So this is really further evidence that health systems and hospitals have an opportunity to position themselves as trusted information sources, as the trusted entity to provide clarity and guidance. We're tracking what it will take for consumers to feel comfortable coming back for an in-person visit. Clearly, they're divided as to when is the right time, and they're looking for local health systems and hospitals to provide guidance. Well, some of the things that we're looking at in the specific behaviors and activities that hospitals and health systems can provide to create a feeling of safety. Some are very expected, such as mask requirements for everyone, both the patient and all employees and the healthcare providers. The availability of social distancing. Those are expected. Other solutions among a laundry list of some that we're testing include social distancing waiting rooms, dedicated hours for at-risk patients, testing before procedures, limiting visitors. So it'll be interesting to continue to see what is it that consumers need to see and how do you need to be behaving in order for them to feel comfortable. The findings to these questions indicates that there is really perhaps room to continue to grow consumer trust and engage with them beyond just the transactional delivery of care. There's room to educate consumers and to position hospitals and health systems as the source of truth and guidance when there's so much conflicting and confusing information. Beyond simply providing health care, there's an opportunity to be a larger resource to the community. For example, one health system of which I'm familiar with is providing local employers with resources to safely reopen their business, whether signage, packages of masks and hand sanitizer and other protective needs, and or access to a healthcare professional to educate and test in the work site, but making it really easy, and again, being that source of truth. So beyond the B2B space, which I just talked about, how can we leverage our knowledge, information, and assets to help consumers feel more confident and comfortable, not only returning to in-person visits or for elective procedures, but just more comfortable, confident, and in control of their lives. As we continue to see the rise in telehealth adoption, as much as a 13-fold increase in 2020 for some clients over 2019, there are more changes in store for those of us in healthcare. And while it's impossible at this point to predict all of them, and yes, this has been a very challenging time, there is great opportunity for those of us in healthcare. We've gone from a place pre-COVID-19 where consumers under the age of 45 trusted Amazon, Apple, and Google at a rate of 2-to-1 over health systems to provide them with the best tools for selecting healthcare, to what is now an opportunity. Overall, hospitals and health systems are most trusted as sources of online healthcare tools and telemedicine. 40% of respondents felt they would most trust a local hospital or health system to develop the best online tool to find and select the right healthcare services. This is almost an exact reversal of where we were in 2019. Let's seize this opportunity. Let's partner with our healthcare consumers to give them control over their healthcare decisions. Let's really listen to what consumers are telling us. And let's design healthcare in a way that responds to those requests. Healthcare providers can seize this moment in time to say, you can trust us. We have been on the front line for you. We have demonstrated that we have the tools and the expertise. We have demonstrated that we do what we say we will do. All the building blocks of trust, which is the most important driver of connection with brands. Connection that drives purchase consideration and ultimately usage. Thank you.
Thank you so much, Sandra. And we thank you guys for attending our webinar. As we mentioned earlier, if you are interested in suggesting additional questions, this tracker will be continuing over the next another iteration at the end of May and at the end of June. So if you have some question that you might want us to reflect, see if we might include it, please send that to sbrown@mdrginc.com. Also, if you would like to be included in the distribution for that, please email us so we can make sure you're on that list. Again, we appreciate your time, and please feel free to reach out if you have any questions about the content of this webinar. Thanks.